Hi, my name is Amber Terhune. I'm the health educator for the Johnson County Health Department. This presentation is about puberty. Puberty is a series of changes in which the body begins developing into adulthood. Don't worry, you're not alone. This happens to everyone. The pituitary gland, which is located in the center of the brain, sends a signal to produce sex hormones. These hormones affect the physical maturing of the body, growth, and emotions. The hormones released in girls include estrogen and progesterone, and for boys it's testosterone. Puberty happens at different times for different people, although girls are usually first. This is why they are usually taller and more mature than boys for a few years. Puberty starts in girls between ages 9 and 13, and for boys between ages 10 and 15. Everyone experiences changes during puberty. They will have a growth spurt, in which the body grows fast in a short period of time. About 25% of height growth happens during puberty. For girls, this growth spurt starts between ages 9 and 11, with them reaching their full height between ages 15 and 18. For boys, the growth spurt starts between ages 13 and 14, with them reaching their full height between ages 20 or 21. They may also experience body odor, or BO. The apocrine sweat glands activate, and the sweat mixes with the bacteria on the skin, creating body odor. About 85 to 90% of all people during puberty will experience acne or pimples. The hormonal changes increase the oil gland activity. Sebaceous glands make the oil called sebum. Sebum can mix with outside dirt or oil inside the pores to create acne. You may find it on your face, upper back, or upper chest. You may also experience emotional changes called mood swings. You may be sad, angry, or confused. You will also find that you have more body hair under your arms, more hair on your legs, and in your pubic area. It starts out light and thin, then becomes longer, darker, and curlier. Here are images showing girls' anatomy. The vagina is the canal between the uterus and the outside of the body. The cervix is the opening to the uterus. The uterus is a hollow, pear-shaped muscular organ located in the lower abdomen or pelvis. This is where a baby grows. The fallopian tubes connect the ovaries to the uterus. Eggs travel through the fallopian tubes to the uterus. There are two ovaries, one on either side of the uterus. They produce the female sex hormones estrogen and progesterone and store and release eggs. There are thousands of eggs present at birth, and they remain inactive until puberty. There are two breasts, one on either side of the upper chest. There are specific changes that girls go through during puberty. Her voice may lower somewhat in pitch, although it's usually not as deep as a boy's voice. Her hips will also begin to widen to prepare for childbirth in the future. She will begin to develop breasts. In the beginning, they may be small raised bumps behind the nipple, known as a breast bud. The nipple and areola, or circle of skin around the nipple, becomes larger and darker, and may be more pointy at first. She will also develop vaginal discharge to keep the vagina healthy. It usually starts about 6 to 12 months before her first period. Fluid and mucus is released, so girls can wear panty liners to protect their underwear. It may be thin or thick, white or off-white, and might have a slight odor. If a girl notices a change in color, a strong odor, itching, or burning, she may have an infection and should call her doctor. Girls will also start to have a menstrual cycle. It usually starts about 2 years after breast development. The first period is called menarche. The body prepares the uterus for a baby by building up blood and tissue. One ovary releases an egg each cycle, known as ovulation. The egg travels through the fallopian tubes to the uterus. If the egg is unfertilized in the fallopian tubes, it passes through the vagina with the blood and tissues from the uterine lining. This is known as menstruation or the period. The period lasts about 2 to 7 days, with the entire cycle ranging from about 23 to 35 days. The average amount of time for the cycle is about 28 days. Periods are often irregular in the beginning, so girls can keep track of them using a calendar. It usually becomes more regular after 1 to 2 years, but sometimes irregularity continues into adulthood. Here are some frequently asked questions girls have during puberty. What size bra do I need? Girls may choose to get a training bra when the budding begins. Once the girl is ready for a regular size bra, they should be measured for their chest and cup size, as bras come in all different shapes, sizes, colors, and textures. What is PMS? It is premenstrual syndrome, and many girls experience it just before their periods. It includes both physical and emotional symptoms such as acne, bloating, fatigue, backaches, sore breasts, headaches, constipation or diarrhea, food cravings, depression, irritability, and difficulty concentrating. Girls can minimize the symptoms with exercise, getting enough sleep, and proper nutrition. Do periods hurt? Some girls have some abdominal cramping from the uterus contracting or squeezing. They may take over-the-counter medications, exercise, use relaxation techniques, take a warm bath, or place heating pads on their lower abdomen. What do I wear when I'm having my period? Girls may choose to wear a pad, which is a rectangular cotton-like material that absorbs the blood, and it is stuck to the underwear. They are also called sanitary pads or sanitary napkins. They come in different thicknesses and absorbency levels. Some have a side material called wings to wrap around the underwear and prevent leakage. Pads should usually be changed about 3 to 6 times a day or every 4 to 6 hours to prevent bacteria buildup and to eliminate odor. They should be changed more often if the period is heavy. Once the pad is removed, it should be wrapped in toilet paper or a wrapper from a new pad. Be sure to throw it away. Do not try to flush them in the toilet. Girls may also choose to wear tampons, which are compressed absorbent materials to absorb the blood, and they are inserted into the vagina. They come in different sizes and absorbency levels. Some may have an applicator to insert them, others are inserted with fingers. The tampon box includes directions. There is usually a string attached that stays outside of the body for easy removal. If the string cannot be found, tampons can be removed with fingers. Tampons should usually be changed every 4 to 6 hours or when they are saturated with blood. If they are left in too long, they may develop an odor and cause infection. When removed, tampons should be wrapped in toilet paper and thrown away in a trash can. Flushing them may cause plumbing problems. Tampons do come with warnings. Girls should wear the absorbency based on their menstrual flow and do not leave the tampon in all day or overnight. Wearing them too long or using a higher absorbency than needed can lead to a rare but serious bacterial infection called toxic shock syndrome, or TSS. Girls may also choose to use menstrual cups, which are flexible materials inserted into the vagina. They collect blood before it leaves the body. It will need to be emptied or disposed of several times daily. Directions are included in the box. Can tampons get lost in the body? No, they cannot. The cervix, or the opening to the uterus, is very small and a tampon cannot fit through it. What if I start my period at school? You can always have a kit prepared, including pads, panty liners, tampons, and clean underwear. Girls can also use a folded up piece of toilet paper in their panties until they can get a pad. Here's a picture showing male anatomy. Boys have a penis. The shaft is the main part of the penis, and the glans is the tip or head. There are also 2 testicles, or testes, which are egg-shaped glands. They produce the male sex hormone testosterone and sperm. The scrotum is the sac under the penis that holds the testicles and the epididymis. It helps keep the testes cooler than the rest of the body so that sperm may be produced. The epididymis and vas deferens are the duct system that transport semen. The prostate gland produces some parts of the semen. There are specific changes boys go through during puberty. They will develop facial hair, which usually starts on the upper lip or chin. They will sometimes develop chest hair. They will get a deeper voice because the larynx or voice box begins to grow. This creates a bulge in the front of the throat called the Adam's apple. Their voice may crack while the larynx is growing. Boys will develop broader shoulders and chest and get more developed muscles. The testicles grow larger, causing the scrotum to get larger and thinner. The scrotum hangs down from the body and tiny bumps or hair follicles appear. The penis grows larger, first in length, then in width. The body then begins to produce sperm to prepare for becoming a father someday. Once puberty is reached, boys will produce millions of sperm cells each day. Boys will also develop erections, in which the penis fills with blood and becomes hard. They will also experience ejaculation of semen, which is sperm and fluid. This comes out of the penis. Here are some frequently asked questions boys have during puberty. Why am I shorter than other people, including many of the girls? Girls usually physically mature faster than boys. Boys grow in spurts, so they will likely grow taller than many of the girls. However, a lot of their height will depend on how short or tall their family is. When do I start shaving my face? Well, this depends on how much hair growth a boy has and when he gets it. He should talk with his dad, an older brother, or a trusted male adult. He should always have his own razor for safety reasons. Why am I getting breasts? Boys may temporarily have small breast growth due to changing hormones. This usually disappears within a few months to a couple of years. Why does my penis get hard sometimes? This is called an erection, and it is completely normal. It can happen for no reason, even if a boy is not thinking about sexual things. Erections aren't as noticeable to other people as what boys may think. Why do I sometimes wake up with wet, sticky underwear? This is called a wet dream or nocturnal emission. This happens when boys ejaculate during their sleep. It does not necessarily mean that a boy had a sexual dream. It is very common during puberty, and boys will probably eventually outgrow it. There are many things that you can do to care for yourself, not only during puberty, but for the rest of your life. For body odor, shower every day, especially after physical activity. You can also wear deodorant or a combination of deodorant and antiperspirant to combat body odor. For acne, clean your skin regularly with mild cleansers, twice daily and after workouts. Don't over-scrub your skin. Choose oil-free makeup and moisturizers. Keep your hands away from your face, as this creates added dirt and oils. Do not pop pimples, as this can lead to scarring. Wash your hair regularly, because the oils from the hair can get onto your face. Acne treatments are available, and for more severe cases, consult a dermatologist. Stay healthy by following proper nutritional guidelines. Include fruits, vegetables, lean proteins, complex carbohydrates, and low-fat dairy. Get plenty of sleep, about 8 to 9 hours each night, and exercise daily. Be knowledgeable about your health, ask questions, and talk to trusted adults. This is the end of the puberty presentation. If you have any questions, talk to your parent, a school nurse, your doctor, local health department, or visit any of these websites. Remember, everyone goes through puberty. You are not alone. Thank you.